Thank you. I'll start by saying thank you, everyone, for being here today. I want us to begin by envisioning a scenario where one falls ill. As is customary, we visit the hospital and relay the symptoms of our condition to a doctor with hopes that they can pinpoint the ailment afflicting us. But the process of diagnosis is anything but simple. This doctor has to make a prediction, a correct prediction, from a plethora of possibilities. Also keep in mind that several diseases have similar symptoms. I can count off the top of my head how many diseases share fever or chest pain as a symptom. Now, studies have shown that a single doctor has a mere 62.5% chance of accurately predicting the correct diagnosis. But this accuracy increases when multiple doctors work together in diagnosing a single patient. But assembling multiple doctors for a single patient is not always feasible and expensive. That is why computer science researchers like myself have decided to come up with tools, specifically computerized tools, to computerized diagnostic decision support systems. But why is this pursuit of paramount importance? Unfortunately, diagnostic errors is the leading cause of death. Shockingly, over 18 million diagnostic errors are made each year, and over 74,000 deaths are attributed to these errors. Misdiagnosis is even more likely to occur among patients with uncommon diseases. These diseases could be rare or diseases that don't occur frequently. Now, what's currently being done about this in the field of computing? Researchers have decided to come up with machine learning tools to aid and supplement doctors in this process of diagnosis. The most popular and widely used method is the supervised machine learning, which necessitates lots of labeled data. So what does this mean? Say, for instance, I want to train a model to be able to describe and identify a dog from images. The first step is to prepare labeled examples that tells this model what a dog is and what a dog is not. Then we train this model with labeled examples, and then the next step is to test this model with some unlabeled examples to evaluate if this model has learned the task correctly. Now, when we have lots of labeled data, supervised machine learning model is desirable. In fact, it's very effective. Even humans learn effectively through examples. But in the case of diseases, these labeled examples are not always available and challenging to find, especially in the case of rare diseases. That has led to the scarcity of supervised models for this condition. And even when they do exist, they are often disease-specific. Imagine having different disease models for different diseases in a hospital settings where we have to consider thousands of possibilities. Imagine, look at this poor doctor. He doesn't even know where to begin. So, my research goal is to build a single generalist model that performs well for a wide range of diseases that includes rare and uncommon diseases. Specifically, the task I aim to solve is giving a patient's clinical note that contains a patient's medical history. I want the model to be able to return a rank list of probable diagnoses. So the goal here is to reduce the search space of possible thousands of diseases to a likely few. To achieve this, we created Clinic IR. Clinic IR is a fully unsupervised model. Fully unsupervised here means the model doesn't rely on labeled examples. Rather, it relies only on published, peer-reviewed medical articles to perform literature-guided predictions. So, to evaluate the effectiveness of Clinic IR, we had to test it on a popular disease dataset called the DC3 dataset. So the DC3 dataset contains 30 complex, unique, difficult to diagnose disease cases that lacks labeled examples. So research previously hasn't focused on those data sets because it lacks labeled data. So we compared Clinic IR's performance on that data set with other biomedical models. And our result here shows that Clinic IR, which is in red, clearly performs better. This result demonstrates that it's possible to achieve a single model that predicts a wide range of diseases that could be frequent difficult to diagnose, and complex. This result holds the promise of a tool that aids doctors in the process of diagnosis and thereby improving patient outcome. Ultimately, this result brings the promise of mitigating diagnostic errors and the consequential patient fatalities. With this, I hope you all understand why my research matters. Thank you.